So immunization here. So this is, in this picture, you can see the immunization list, disease list, like hepatitis B, rotavirus, diphtheria, tetanus, pertussis, Haemophilus influenza, pneumococcal, inactive polio, influenza, measles, mumps, varicella, hepatitis A, and meningococcal vaccine. So hepatitis B we give during the birth. So total dose of hepatitis B are 3 doses, right? First dose we give during the birth. Second dose we should give during the second year of life, second month of life, and third dose we should give during 6 to 18 months, right? So, as I told you, for the vaccination, what we have to know and what NCLEX board asks. So, basically, like when you give the vaccine, like baby need hepatitis B at the birth or rotavirus during the second month, and after the immunization, there's some of the side effect. So what are the side effect of immunization? It is very important we should know. So they can cause low-grade fever or tenderness, swelling at the site, or child may develop irritable or may become irritable. So if patient develop any side effect, what medication you should be given for those side effects? We should give acetaminophen or Tylenol, acetaminophen, and never give the aspirin to the children to experiencing those side effects. Those means low-grade fever, tenderness, swelling, or any other like irritabilities. Never give aspirin, because aspirin can cause the side effect, and it is called Ryle syndrome, right? So like hepatitis B, first dose at the birth, second dose during the second month, third dose, as I told you, patient can take from 6 months to 18 months. Easy to remember, basically patient follow the at the birth, second month, and 6th month. The last dose is called the booster shot. If I ask you what is the booster shot, it is an additional dose of vaccination to increase the effectiveness. Right? So it is very important. So I want to share with you right now. Another one like MMR, right? MMR. So MMR, usually if an adult woman receive the MMR, what should you educate your patient? What should you educate your patient? I said MMR means M for measles, M for mumps, M for rubella. This is called MMR vaccine. So let me show you. Okay, so we are actually here. This is MMR. Here we are. So if we go here, this is MMR. So here we are, right? MMR. So MMR, I said, if a mother take the MMR, it has to tell your patient, wait 3 months before next pregnancy. I want to recap it for you. So if an adult woman receive a MMR, MMR stand for measles, mumps, and rubella. What should you teach the mother? You has to tell, wait 3 months before pregnancy, right? Another vaccine basically we give is for the flu, is called influenza. This here, influenza vaccine. So influenza, when you give, you see influenza yearly, right? If you go in somewhere in doctor office, doctor, or in USA, every year we take the influenza vaccine. So keep it in mind, it's very important. Usually asks the question NCLEX board, how soon can a child get the influenza vaccine? How soon? So answer should be not until the 6th month. So infant or child can take the influenza vaccine after 6 months. Before 6 months, you never ever give the influenza vaccine to them. Another question, usually NCLEX board asks that, like MMR, mumps or rubella. So we do not give the MMR vaccine if the client has an allergy to AIDS or allergy to neomycin, right? I want to recap it. MMR, this is the MMR, right? MMR stands for measles, mumps, or rubella. Do not give MMR if the client is allergic to AIDS or neomycin. And also do not give influenza vaccine if the client is allergic to the AIDS, right? So this is the very basic information. If you know for the NCLEX board, it can help us to answer the question. So now I'm going to discuss the second vaccine. Is called rotavirus vaccine. Rotavirus, right? Rotavirus can cause very bad diarrhea or GI infection. Rotavirus is a contact precursor. Contact precursor, I said, because immunization, we give the baby to protect some disease, right? Some communicable disease or some transmission-based disease. So rotavirus, I said, contact precursor. So rotavirus, there are 3 doses. The first dose, second dose, 4 months, and third dose during 6 months. So you can see the picture. So RV stand for rotavirus during the 2nd month, during 4 months, during 6 months. Hepatitis B also during the 2nd month, right? Now go for third one, is called DTaP, diphtheria, tetanus, and pertussis, shortly called DTaP. D for diphtheria, T for tetanus, and P for pertussis, right? So 3 disease combined vaccine, shortly called DTaP, right? So diphtheria, they are contact precursor. Diphtheria is a contact precursor or cutaneous infection. Okay. And pertussis. Pertussis is a droplet precursor. Pertussis is a droplet. Diphtheria, in some of the book mentioned diphtheria is also droplet. Diphtheria is a droplet and contact both. But pertussis, other term is called whooping cough. Pertussis is a droplet precursor. Don't forget it. So DTaP total dose are 6 doses. 6 doses. The first dose we give during the second month, like rotavirus and hepatitis B. Second dose during 4 months. Third dose during 6 months, is like rotavirus, also second month, 4th month, 6th month. But DTaP, next dose, we allow the patient to take 15 to 18 months. 15 to 18 months. And consequence doses, we prefer to tell the patient can take 4 to 6 years and 11 to 12 years, and booster every 10 years, booster dose, right? So as I told you, what is the booster dose? It is the additional, right, doses that increase the strength of the vaccine. It is very important. Booster dose and additional dose of vaccine to increase the effectiveness, right? So next one is called HIV, means Haemophilus influenza type B. Haemophilus influenza type B, basically droplet precursor. Droplet precursor, right? So the HIP is a 3 doses. The first dose, second month, second dose, 4 month, and third dose, usually 6 month, right? HIP. But some book mentioning the third dose give 12 to 15 months. The next important vaccine are called PCV or pneumococcal vaccine. PCV, pneumococcal. So PCV basically prevent the pneumococcal infection, right? And here, because pneumococcal sometimes causes the pneumonia. Pneumonia is sometimes bacterial pneumonia or Klebsiella pneumonia. If the bacterial pneumonia, they are droplet precursor. If Klebsiella pneumonia, they are contact precursor. Make short, the pneumonia are droplet and contact. Like diphtheria, diphtheria is droplet and contact. Diphtheria pharyngeal or pharyngeal diphtheria is a droplet, but the cutaneous diphtheria is a contact. So, as I told you, we give the PCV vaccine for prevent the pneumococcal. So, PCV vaccine, there are 4 doses, like first dose, second month, second dose, 4 month, third dose we can give during the 6 month, and final dose we give during 12 to 15 months, like the HIP vaccine. The other one most important is called IPV or inactivated polio vaccine. Inactivated polio vaccine, right? So, you know, the polio is almost eradicated from the world because of the polio vaccine. So shortly called IPV, and we use it for polio virus. There are 4 doses for polio. First dose during the 2nd month, second dose during 4 months, and third dose during 6 to 18 months. 6 to 18, any time in between 6 to 18. But it is easy to remember better during 2 months, during 4 months, and during 6 months, we give the consequence doses. IPV, I said 4 doses. The last dose we can give 4 to 6 years, right? Now go for measles, mumps, and rubella, right? So measles is a airborne precursor. Measles, other name is called rubeola, right? And mumps is a droplet precursor. Mumps is a droplet precursor, we said. And rubella is the contact precursor, right? So as I told you, shortly called MMR vaccine, basically 2 doses. MMR are 2 doses. So first dose usually give 12 to 15 months. 12 to 15 months. And second dose we give the patient 4 to 6 years of old, MMR. So could you remember what I told you about the MMR before? We told if any adult women receive the MMR, what should you tell them? You should tell them to wait 3 months before get pregnant, right? Second note, I said, do not give MMR if the child is allergic to eggs or neomycin. Allergic to eggs or neomycin, right? So now we are going to the other vaccine, and that one is called varicella, right? Varicella, shortly called BAR, right? And varicella can cause the chicken pox. Varicella, they are airborne precursor. Okay. So first dose we give as like MMR during the 12 to 15 month, and second dose 4 to 6 years. Okay, MMR. Then this is varicella, and another one is called hepatitis E. Hepatitis A, basically 2 doses. The first dose schedule 1 to 2 years, and second dose 6 to 18 months after first dose. I want to recap it. Hepatitis A, basically 2 doses. The schedule of hepatitis A, the first dose we give 1 or 2 years. Second dose 6 to 18 months after the first dose. The another vaccine we are useful called meningococcal. So meningococcal, they can prevent the meningitis. Meningitis is a droplet precursor. To prevent the meningitis, we can allow the patient to take meningococcal vaccine. Meningococcal vaccine only 1 dose. Usually we give them 11 to 12 years, and booster dose at 16 months. Okay. It is important you have to know usually when should the meningitis vaccination is be given before going to the college. I want to recap it. Meningococcal bacteria can cause meningitis. Meningitis are a droplet precursor, right? So when should the meningitis vaccine be given? We give it before going to the college, right? And as I told you, meningococcal is only one dose, and we give it to the 11 to 12 years. And booster dose, if you want, we allow during the 16 years of old. So now we are going to the second portion of the here. So definitely we also has to know some expected outcome, what I told you before, and there's some condition where vaccine are not good to give, right? So this is called contraindication of vaccination. It's called contraindication of vaccination. So what I told you, I am going to review it for you. Okay, otherwise you should forget it. So DTaP vaccine. DTaP means D for diphtheria, T for tetanus, and P for pertussis. DTaP total 5 doses should be given, right? DTaP. The other is called IPV, means polio vaccine. IPV stands for inactivated polio. And this IPV, basically we give for 4 doses, right? 4 doses. IPV. First dose during the second month, second 4 month, third dose 6 to 18 months, and fourth number dose we give 4 to 6 years of old. And last one is the booster dose. PCV for pneumococcal. What we have to know, this vaccine help protect young children from develop meningitis or any kind of blood infection or sepsis. There are some very basic information about the influenza or flu vaccine, right? As I told you, we never ever give the influenza vaccine if anybody has an allergic to the eggs, right? Second note, I said, if your children less than 6 months, you never give the influenza vaccine. So now not give to anyone younger than 6 months of age. The inactivated flu vaccine is recommended for all children 6 to 23rd month of age or lifelong. Children 24 months and older with certain medical condition like asthma, chronic heart disease, chronic lung disease, or impaired the immune system, they should take the influenza vaccine. MMR stands for measles, mumps, rubella. What you has to know for this? If your client has a allergic to the eggs or neomycin, you never give them MMR vaccine. So maybe combined or separate. So this is a one vaccine for 3 diseases. You give a combined or you can give defined separately. MMR, how many doses? 2 doses, right? So do not get pregnant within the 3 months. When mother take it, and tell them do not take, because can cause the teratogenic to the children. Other vaccines called TD vaccine combined for tetanus and diphtheria, right? And as I told you, diphtheria is a pharyngeal diphtheria and cutaneous diphtheria. Pharyngeal diphtheria is called droplet precursor, and cutaneous diphtheria is called contact precursor. So DTaP recommended for anyone over the age 7. Hepatitis B vaccine, right? During the birth. So hepatitis B, 3 doses, and first dose during birth, second dose 2 months, and third dose 6 to 18 months. Hepatitis B, you must check the patient has any kind of yeast allergic infection. If patient have any allergic or yeast allergic infection yeast, we do not give it. Another is called pertussis, right? So pertussis, what kind of precursor? Droplet. Every information is very important for NCLEX export. Treatment for pertussis is a erythromycin. Again, pertussis is a droplet precursor. What are the antibiotic we use for pertussis? Erythromycin, right? Now go for another important point, contraindication of vaccine. Contraindication of vaccine, we said. And here, the contraindication of vaccination. So vaccine, follow me please. Vaccine are not contraindicated for the common cold or minor illness, but some medical condition vaccine are contraindicated. What is this medical condition? One is if patient has a previous severe allergic reaction, it's called anaphylactic reaction. It's called the anaphylactic reaction here, anaphylactic reaction, right? So we do not give them. Also, if has an allergy to the component of vaccine, if patient has an allergic to the component of the vaccine, we do not give it to them. Moderate to severe illness, moderate to severe illness, we never give the vaccine. If the pregnancy especially, we do not give rubella or polio. If the pregnant, we do not give. And definitely we have to talk to the healthcare provider for any vaccine or anything. So, and also if your patient has severe immunodeficiency condition, or if the patient has recent blood transfusion. So this is the condition basically we do not allow to the patient for vaccination, right? I want to recap it again. What are the contraindication of vaccine? If the patient previously allergic, previous severe allergic reaction called anaphylactic reaction, allergy to the component of the vaccine, moderate to severe illness, or if they are pregnant, or severe immunodeficiencies, right? So now we are going to the second portion of the classes. So just follow me what I said. If your patient has allergy to the latex, I'm going to recap it. If your patient has a allergy to the latex hepatitis A is a contraindicated. If patient has an allergy to the yeast, hepatitis B contraindicated. If patient has an allergy to yeast, HPV is contraindicated, right? I'm going to recap it, my friend. If patient has a allergy to neomycin or streptomycin, the polio vaccine is a contraindicated. Polio, shortly called IPV. If patient has an allergy to the eggs or gelatin or allergy to neomycin, MMR vaccine contraindicated. If patient has an allergy to gelatin, neomycin or corticosteroid, varicella vaccine is a contraindicated. If patient has an allergy to latex, hepatitis A contraindicated. If patient has an allergy to yeast, hepatitis B is contraindicated. If allergy to the yeast, HPV is a contraindicated, right? Now go second portion here. When we give the antibiotic, means administration of immunization or vaccination. So we are going to talk about the immunization administration, right? Infant and young children, we give the immunization or vaccination to this muscle. This is called vastus lateralis or ventogluteal muscle. So this one here, this is the ventrogluteal muscle here. Okay, so infant or young children, vastus lateralis or ventrogluteal muscle. If the older children or adult, we use the deltoid muscle. We use deltoid. This is the deltoid muscle for older children or adolescents. Deltoid. Something is very important we have to know for the board exam. When you give the vaccine or immunization, always keep the documentation, right? So documentation is really, really important for the patient here. And also it is important that when you keep the document, you have to write the date, route, site of immunization, time, also manufacturer or expiration date. Like patient today, it is 11/5/2020. If you give them vastus lateralis muscle, IM intramuscular, what the site? Vastus lateralis, intramuscular, right? And also the vaccine is called polio vaccine. You have to write everything: date, route, site, time, manufacturer, or expiration date. When patient is ready to discharge, what you have to tell your patient? You have to tell expected side effect. Means low-grade fever, pain at the injection site, or patient can feel malaise, tenderness, patient become irritable. All are expected side effect. If your patient know, then it's fine. So also you have to teach the parents to not to give aspirin to the children, to treat for the fever. I am going to recap it because it is super important for NCLEX board. Why not aspirin? Due to risks of Ryle syndrome. For the infant, use an oral sucrose solution on the pacifier before or during or after injection. So this is actually important information regarding the immunization or vaccination.